Have you ever stopped in the middle of your day, held your head, and wondered, what kind of headache is this, and why is it happening right now? Because not all headaches are the same, and treating them the same way can sometimes make things worse. Welcome to Mind Matters Expert. Today we're going to break this down together so the next time a headache hits, you don't just react, you understand exactly what your body is trying to tell you. Is there anyone in the world who has never experienced a headache? Probably not. Headaches are one of the most common health complaints, affecting people of all ages and lifestyles. Some are mild and can be managed at home, but others may signal something more serious and require immediate medical attention. In this comprehensive guide, we'll walk you through 5 common types of headaches, their symptoms, their causes, and the best ways to relieve them. By the end, you'll have a clearer understanding of what your body might be telling you and when it's time to seek professional help. Tension headache. Let's start with the most common one, the tension headache. Tension headaches are the most frequently experienced headaches worldwide. Almost everyone has dealt with this type at least once in their life. You might notice a constant pressure, like a tight band wrapped around your forehead. There's often tension around the eyes and the upper forehead. The pain is usually dull and aching, not sharp, and it tends to get worse gradually from morning to evening. So what causes this? In most cases, it's stress, anxiety, fatigue, or even poor posture. Something as simple as holding your head in the wrong position for too long can trigger it. In rare situations, chronic tension headaches may be linked to head or neck injuries. Now, how do you deal with it? You can take over-the-counter pain relievers, but only occasionally. Staying physically active helps a lot. Regularly stretching your neck and shoulders can make a big difference. And spending time outdoors helps reduce stress levels. But if these headaches keep coming back or last for a long time, it's important to consult a doctor. Sinus headache. Now let's talk about something that often gets confused with migraines, the sinus headache. Sinus headaches are usually caused by sinusitis, which is inflammation of the sinuses. Here's how you can recognize it. You'll feel a deep pressure in your forehead, pain around your eyebrows and under your eyes. It often gets worse when you move your head suddenly. You might also have a blocked or runny nose, facial swelling, fever, and fatigue. So what's behind it? It could be a sinus infection, a complication after a cold, or even seasonal allergies. And here's something important. Sinus headaches rarely go away on their own. If allergies are the cause, antihistamines might help. But in many cases, a doctor will need to prescribe antibiotics. So instead of guessing, it's always better to seek proper medical advice. Next, let's move to a more complex and intense condition, migraines. Migraines are not just headaches. They are neurological events linked to metabolic changes and the dilation of blood vessels in the brain. And for some people, this tendency can even be inherited. First comes the prodrome, which can start 1 to 2 days before the actual headache. You may feel irritable, fatigued, or notice changes in your appetite. Then comes the aura phase, lasting up to 30 minutes. You might become sensitive to light, feel tingling or numbness, or even experience speech difficulties. After that comes the headache phase, which can last up to 72 hours. This is where the severe throbbing pain kicks in, often on one side of the head. And finally, the resolution phase, which can last up to 24 hours, leaving you feeling tired and unable to focus properly. So what causes migraines? Changes in brain chemistry, blood vessel dilation, and genetic factors all play a role. Now, when it comes to treatment, there's no complete cure yet, but doctors can prescribe medications to help manage the symptoms. And something simple, like regular exercise, can significantly improve your overall health and reduce how often migraines occur. Still, the most important step is to consult a healthcare professional for proper diagnosis and treatment. Now let's look at one of the rarest, yet most painful types, cluster headaches. These affect less than 1% of the population and are much more common in men than in women. What makes them unique is how intense and specific they are. You'll feel a sharp stabbing pain, usually behind or around one eye. It typically affects only one side of the head and often starts during sleep. The pain can last anywhere from 15 minutes to an hour, and it's often accompanied by red eyes, tearing, and sensitivity to light. As for the cause, scientists are still not completely sure, but they are often linked to disruptions in the body's biological clock. Treating cluster headaches can be tricky because they appear suddenly and disappear just as quickly. This is not something you should try to manage on your own. Medical treatment is necessary, and only a doctor can guide you properly. Finally, let's talk about something many people are familiar with, hangover headaches. These happen after consuming alcohol and, honestly, can be surprisingly uncomfortable. The symptoms usually include a throbbing or dull aching pain and a feeling of heaviness or tightness in the head. So, why does this happen? Well, alcohol causes blood vessels to dilate, affects serotonin levels, and leads to dehydration, which is a major trigger for headaches. So, what can you do? Take a mild painkiller, drink plenty of water, and get enough sleep. But here's something to keep in mind. If you get a headache even after a small amount of alcohol, it could be a sign of a mild migraine condition. So now let me ask you, when you get a headache next time, will you just ignore it? Or will you try to understand what type it is? Because while many headaches can be managed at home, ignoring persistent or severe symptoms can be risky. Self-medicating without proper guidance can sometimes lead to serious consequences. That's why it's always important to consult a doctor before taking medication, especially if your headaches are frequent, getting worse, feel unusual, or start affecting your daily life. Now, here's a quick challenge for you. If someone tells you they have pressure around the forehead, a blocked nose, and pain that gets worse when they move their head, what type of headache do you think it is? And another one. If the pain is sharp, intense, and focused around one eye, especially at night, which headache does that sound like? Drop your answers in the comments, and let's see how many of you got it right. Headaches may be common, but they should never be taken lightly. Understanding their types and their causes is the first step toward effective treatment. Stay active, stay hydrated, and most importantly, listen to your body. Because when it comes to your health, every detail truly matters. If this helped you understand your headaches better, share it with someone who always says, "It's just a headache." And don't forget to like, subscribe, and stay with Mind Matters Expert, where we turn everyday health problems into clear, practical knowledge.